in some parts of the country, we are seeing the number of daily cases caused by the Omicron variant beginning to decline. But as we have seen during other phases of this pandemic, the surge in cases started at different times in different regions and may continue to see high case counts in some areas of the country in the days and weeks ahead. Today, I would like to discuss 3 new reports being released by CDC that provide a look at vaccine protection against Omicron, including the added protection provided by booster doses. These reports add more evidence to the importance of being up to date with COVID vaccinations. That means getting your primary series and getting boosted when eligible to protect against severe COVID-19. The first report published today in CDC's Morbidity and Mortality Weekly Report, or MMWR, examines the effectiveness of mRNA vaccines and how they've been preventing emergency room visits, urgent care clinic visits, and hospitalizations. The blue line on this slide represents the period when Delta variant was dominant. Vaccine effectiveness against emergency room and urgent care visits for those who received their primary series was 76% at 6 months after receiving the second shot. As you can see, following a third shot, vaccine effectiveness increased up to 94%, even higher than it was in the first 6 months after vaccination. Now, still looking at emergency room and urgent care clinic visits, vaccine effectiveness against Omicron is displayed by the red line. In general, we see lower overall vaccine protection against Omicron as we saw against the Delta variant shown by the blue line, especially with just 2 doses of an mRNA vaccine. For those who received the first 2 doses, vaccine effectiveness was 38% against emergency room visits and urgent care visits after 6 months. However, vaccine effectiveness increased up to 82% for those who received their booster dose. The effectiveness of the booster dose is close to the level of protection that was experienced for those with boosters during the Delta wave. The next slide shows vaccine effectiveness against hospitalizations, both with the Delta variant, again the blue line, and against hospitalizations with the Omicron variant, again the red line. Similar as to seen with emergency department visits on the prior slide, for both the Delta and Omicron variant, there was a decline in vaccine effectiveness against hospitalization over time. But following a third dose, vaccine effectiveness against hospitalization with Omicron increased to 90%, nearly matching the effectiveness against the Delta variant and even higher than vaccine effectiveness after the first 2 doses of the mRNA vaccine. Overall, for those who received a booster dose, had the most protection against emergency room visits, urgent care clinic visits, and hospitalizations. An additional study, also published today by CDC scientists in JAMA, further adds to this evidence. This JAMA report similarly shows that a booster or third dose of the Pfizer or Moderna COVID-19 vaccine provides greater protection against symptomatic COVID-19 disease for both the Omicron variant and the Delta variant compared to the primary series alone. To further demonstrate the protection of boosters, we're publishing data in MMWR on CDC's COVID data tracker as well that look at cases and deaths by vaccination status. In these data, you can see significantly lower case and death rates among those who are boosted compared to those who are unvaccinated. The graph on this slide displays data from 28 jurisdictions, representing over 2/3 of the US population. The blue shaded area represents the time that the Delta variant was dominant, and the pink shaded area when Omicron variant is dominant. As you can see, case rates are highest among those who are unvaccinated, represented by the black line on the top graph. Case rates are lower for those who have received their primary series, represented by the light blue dotted line, and lower still for those who have received their booster dose, represented by the solid blue line at the bottom of the graph. During December, when Omicron was first emerging, unvaccinated adults had a 5 times higher risk of infection when compared to adults who had received a booster dose. The data here show that the protection provided by vaccines and the importance of being up to date on your COVID-19 vaccination, which for tens of millions of Americans means getting your booster dose. Taken together, these data highlight two important points. First, those who remain unvaccinated are at significantly higher risk for infection and severe COVID-19 disease. Second, protection against infection and hospitalization with the Omicron variant is highest for those who are up to date with their vaccination, meaning those who are boosted when they are eligible. There are still millions of people who are eligible for a booster dose and have not yet received one. As we continue to face the Omicron variant, representing over 99% of infections in the United States today, I urge all who are eligible to get their booster shot to get it as soon as possible. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. What I'd like to do over the next several minutes is to answer a question that's shown on this first slide. And that is, when new variants arise, why do immune protection against infection diminish much more so than does protection against severe disease? And what are the immunological mechanisms that account for that and account for what Dr. Walensky just described clinically to you a moment ago? These are somewhat technical concepts, but I'd like to give you the bottom line message from each of these. Next slide. When one thinks about either infection or vaccination, although there are a lot of things on this slide, the fundamental basic message is that there are two limbs of the response. The B cell limb, which provides the antibodies that we measure when we show you neutralizing titers. Those B cell responses can give antibodies, but also memory. Namely, when they see an antigen again, which I'll explain in a moment, they respond quickly. The other limb of the immune response is the T cell limb, which in some respects helps the B cells to make antibody, but have function of their own, both direct function and memory function. So now I want to describe some of the terminology that you probably are hearing about when new scientific papers come out. So here's some simplified explanation of these very complex responses. An antibody that's made by B cells primarily prevents initial infection. They are more specific than T cells, and their half-life or their durability in the plasma are shorter lived, but they are backed up by memory cells that are more durable. T cells, however, generally prevent the progression of a disease, namely prevent progression of an infection you already have by eliminating the virus-infected cells. They have a greater breadth, namely they are more cross-reactive in many respects than antibodies. Next slide. Now, when you talk about the, can I have the next slide, please? When you talk about the antigens and epitopes, an antigen is a molecule capable of stimulating an immune response. So viruses themselves are big antigens, and parts of viruses are also antigens. But the antigens themselves have many components. We refer to them as epitope. Why does that mean anything to us? It does because B cells specifically respond and react to B cell epitopes. Namely, antibodies recognize certain parts of an antigen, and T cells recognize certain parts of an antigen, and they're called T cell epitopes. When you give an antigen in a vaccine, we refer to it as an immunogen. So let's take a look at what that means and why it's important to understanding the clinical issues. Next slide. So this is a picture schematically of the now spike of the coronavirus of SARS-CoV-2. The arrows on the left are pointing to what we call B cell epitopes. They mostly on the surface. And when a virus mutates the way these variants do, it causes changes that interfere very, very easily with the binding of antibodies. We see this specifically impressive with monoclonal antibodies. So a single mutation, for example, might nullify the effect of a monoclonal antibody. You go to the right-hand part of the slide, and then those parts that are reacted to by T cells, which we refer to as T cell epitopes, they are on the surface, but they're also buried. The changes that affect an antibody do not nearly impact as much T cell recognition. And that is absolutely critical, because that's one of the reasons why when you have variants that change, in fact, you still have protection against hospitalization, because T cells, as I mentioned a moment ago, protect more against progression of disease. Next slide. This slide actually tells you that, because if you look at either the left or the right, when you go from one variant to another, there's a great deal of conservation of these T cell epitopes, so that even though the variant changes, either a vaccine or a prior infection can give you protection against the various variants. And then on the next slide, this slide just merely shows papers that many of you have read about, that vaccination can induce memory able to cross-react all the variants from alpha to beta to delta to Omicron. Next slide. Same thing with laboratory studies that T cells induced from vaccination or prior infection seem to hold up well. Next slide. Now, getting back to what Dr. Walensky said, these are data from the UK. She showed us data from the United States. They're very similar. If you look at just symptomatic infection on the left, 2 doses of an mRNA, and this is Omicron, 2 to 4 weeks later, have a 65 to 70% protection. But as Dr. Walensky showed, if you look about 10 weeks later, you have only a 30%. When you give a boost, you bring that up 65 to 70 and 45 to 50. But the important part of the slide is on the right with the red. When you look at 2 doses plus a boost, you get very good, durable protection against hospitalization. That is the important key issue. Next slide. So what's the bottom line of what I've said? Protection against SARS-CoV-2 infection is mediated mostly by antibodies that are generally short-lived. Variants with extensive mutations easily escape protection from infection, which is the reason why you saw the data that Dr. Walensky showed you. But protection against severe disease is mediated predominantly by memory B cells and CD4, CD8 T cells. These are longer lived and more broadly reactive. And so the current vaccines, particularly with regard to boosting the current regimens, continue to induce immune responses that provide strong protection against severe disease, hospital, and death. Therefore, final slide, the same message that Dr. Walensky gave you. Get your vaccinations up to date. It is essential for your protection. Back to you, Jeff.
Well, thank you, doctors. Before we turn to questions, I want to provide some perspective on where we stand. As you've heard the doctors say, Omicron is an extremely transmissible variant that has driven an unprecedented number of cases in recent weeks. But as a nation, we're in a far different place than we were this time last year. 210 million Americans are fully vaccinated and therefore protected from serious illness, especially, as the doctors have said, if they've received a booster shot. 96% of K through 12 schools are open for in-person learning, up from just 46% this time last year. And we're coming off the greatest year of job growth in American history, an amazing economic turnaround. The reason this January is so dramatically different from last January is because we have the tools we need to protect people. And because President Biden and his administration have acted aggressively to follow the science and deploy these tools. And because so many Americans have done the right thing and taken the steps to protect themselves, their families, and their communities. As we recognized from the start, vaccines are the single most important tool we have in the fight against this virus. We established a nationwide vaccination program that's gotten more than 500 million shots in arms. Today, nearly 75% of adults are fully vaccinated. That's up from just 1% at this time last year. And importantly, we keep driving additional progress with about 9 million more shots going into arms each week. On testing, we've increased manufacturing capacity by making multi-billion-dollar investments and deploying the Defense Production Act. And we've created new streamlined pathways to get tests authorized more quickly. As a result, we've gone from 0 at-home tests when the president took office to having 375 million tests available in January alone. And now private health insurance covers the cost of at-home tests. And you can order at-home tests to be delivered to your home for free. On treatments, we've stocked the nation's medicine cabinet so that we have more effective treatments available now than at any other point in the pandemic. Importantly, including Pfizer's antiviral pill, a game changer that helps keep people out of the hospital. We've secured 20 million treatment courses of the Pfizer antiviral pill for the American people. And working closely with Pfizer, we accelerated the delivery of these pills. We continue to take additional steps to ensure that Americans have what they need to protect themselves, including by making hundreds of millions of N95 masks available for free to all Americans. This is the largest deployment of personal protective equipment in U.S. history. We've already shipped millions of these masks out, and across the coming days, masks will begin to be available at local pharmacies and community health centers across the country. So we've come a long way in our fight against the virus. Across the last year, we've provided multiple layers of protection for people: vaccines, boosters, tests, masks, and treatments. And even as we face the extremely transmissible Omicron, we see that these tools are working. In fact, fully vaccinated individuals are 16 times less likely to be hospitalized from COVID compared to those who are unvaccinated. And schools and businesses are open. As the president says, we know the job is not yet finished. But because of how many people we've gotten vaccinated, the country is in a much stronger position to face Omicron and to deal with COVID going forward. And because of the administration's actions, we're moving toward a time when COVID won't disrupt our daily lives, where COVID won't be a constant crisis, but something we protect against and treat. We're not there yet, but the president's COVID plan is clearly working. And we're confident we'll continue to make progress and get to where we all want to be.